Do you want to learn some science or cure some dangerous disease? Heart anatomy is the best. Let's run a blood test. Schistosomiasis. It's fun to learn together. All the arteries, just watching out for the veins. Do you want to learn some science? Come on, let's learn some science. Let's try.
Hey everyone, welcome to this week's episode of Dr. Heart. Dr. ECG and I are going to be talking about rheumatic fever and rheumatic heart disease.
What is rheumatic fever?
It's a disease that's caused by a bacterium called streptococcus that gets into your body and makes you really sick.
That's a really funny name.
It is a funny name. What happens is you get a fever, have a really sore throat called strep throat, and you might start to feel your heart beating really fast or funny in your chest. Your wrists and elbows might also be really sore.
Cool, why does this happen?
Well, the little bacteria are going to cause your body to react and try to get rid of it. The problem is the bacteria are pretty good at disguising themselves. Sometimes the body accidentally hurts itself because it thinks it is the bacteria. This triggers what's called an immune response.
Yikes, that doesn't sound good.
No, it's not. The main place the body's going to hurt itself is in the heart. Once rheumatic fever damages your heart, it becomes rheumatic heart disease. Dr. ECG is going to talk a little bit more about the heart.
The heart is the organ that pumps blood throughout our whole body. Without our heart pumping properly, our brain and muscles wouldn't be able to get enough oxygen to survive. So the heart is really important. Now, do we know anything else about the heart?
We know there are 4 chambers in it.
Yeah, you're right. Think of your heart as a house. It has 4 rooms, 2 on each side. Now connecting the rooms of the house are doors. The doors represent the valves in your heart.
What do the valves do?
They're responsible for making sure that blood flows only in one direction through the heart. Kind of like how doors only open in one direction.
Oh, I get it now.
Good. Okay, so now that we know how the heart works, I'll pass it back to Dr. Hart.
Well, in rheumatic heart disease, one of the valves, called the bicuspid valve, is damaged. The cusps of the valve become inflamed and stiff. Do you know what inflammation is?
No.
Okay, so when you get a bug bite on your arm, the spot gets swollen and red. This is an example of inflammation.
Oh, that's so cool.
Oh, because this valve is inflamed, known as valvulitis, this can cause a lot of problems with how your heart works. Remember how the valves are like a one-way door? If inflammation causes the door to get bigger and heavier and the hinges get stiff, would it be harder or easier to open this door?
It would be harder.
Exactly. If inflamed, the valve doesn't close as well, meaning blood might start flowing backwards. This is known as regurgitation. If the valve can't open properly, not as much blood is going to be getting into the next chamber, and this is called stenosis.
Okay, so if the valve isn't closed and blood is going in the wrong way, there would be less blood flowing through?
Yep, you got it. Because the valves aren't working properly, the sound you hear is called a heart murmur. And if your body isn't getting enough blood, your heart's going to speed up to try to make up for it.
That's really cool, but this sounds like a really scary disease. If I get sick, is there medicine we could take to get better?
I'll let Dr. ECG take you through that.
To treat rheumatic fever, it's pretty easy. You get a shot of medicine called penicillin, which is an antibiotic. This will kill all the bad bacteria that is in your body and hopefully prevent your body from attacking the heart.
Wow, that actually makes me feel so much better. So, if I have a really sore throat, should I tell my parents?
Yes, definitely. The problem is, once your body attacks your heart and you develop valvulitis, there aren't any medications you can take to get better fast.
What can you do then?
If rheumatic heart disease develops and you get a heart murmur, your doctor might give you medication to help control your heart rate, and depending how bad it is, you might need an operation to fix the valve. But even if you have rheumatic heart disease, scientists have shown that being in a peer support group really helps.
Yikes, that's really serious.
Yes, it is, which is why it's better to prevent rheumatic fever. In other words, stop the disease before it gets worse. I'll pass it back to Dr. Hart.
Rheumatic fever, there is primary and secondary prevention. Primary prevention is going to be the same as the treatment for rheumatic fever, taking antibiotic pills like penicillin or getting a needle to stop the bad little bacteria from causing more damage.
Antibiotics are like superheroes, aren't they?
You're totally right. Now, secondary prevention is after you've already been sick once and don't want it to happen again. In this case, your doctor or nurse is going to give you a shot every month of our superhero antibiotics. It's also super important that you keep getting these shots or taking your medicines for as long as your doctor tells you.
The reason we made this video is because education is another big way to prevent rheumatic fever. Because now you know if you have a sore throat and feel really sick to tell your parents and go to the doctor as soon as possible.
Yes, I will!
Thanks for joining us today. We hope you learned a lot about the heart and rheumatic fever. Tune in next week for our episode on high blood pressure.
Do you want to learn some science? Maybe not neuroscience. Let's try.